do patients recover? Can you fully recover from GBS?
Yes, definitely. If the patient has been treated early, or else if there are no comorbidities, a patient who is younger, definitely they will be having a better prognosis or else a good recovery. For some people, even after giving the IVIG medication or after doing the plasma filtration, recovery might be really slow. Here we can wait for the period of 2 to 3 weeks. And for some people, the GBS can, the strength of the person or else the neurological problems can slowly recover. It has been said that over a period of 6 months, the recovery can be noticed in almost 80% of the people. So it is a slowly recovering illness even after giving the treatment.
Is it a recurring one? Can you get it again?
Yes. So initially when the patient of the GBS comes, we will do the limited number of the tests on them, and if the recovery is better, then probably the physiotherapy and then the vitamin supplements would be sufficient for them. In case the GBS, even after treating, if it is worsening or else there is a recurrence in the weakness, then probably we have to evaluate more for in these patients. There are certain autoimmune tests, there are certain antibodies tests, heavy metal test, or else the immunofixation panels. They are the different set of the things one needs to have a look if the GBS is recurring, or else something called as a porphyria or else other autoimmune diseases can really cause the recurrent episodes of GBS, in whom the treatment would be different.
Different?
Yeah, it is different.